There are three different types of pipettes that will be used in the maternal ancestry experiment: the P1000, the P200, and the P20. The number refers to the maximum microliter volume that a pipette can handle. For example, the P200 can deliver up to 200 microliters of liquid. Now, with the appropriate pipette size, you'll need to set the pipette to the specific volume depending on the procedure. To change the delivery volume of any pipette, turn the black locking mechanism to the left so that the plunger can be adjusted. Turning the plunger to the right will decrease the volume, while turning it to the left will increase it. The P200 is the most straightforward because the numbers shown simply represent the volume in microliters. The P1000, however, has a red first digit indicating that it is 1,000 microliters. For example, if the P1000 pipette reads 090, it means that 900 microliters are delivered. In a similar way, the red last digit of the P20 represents numbers after the decimal point. For example, if the P20 pipette reads 185, the volume of delivery is 18.5 microliters. It is important to become familiar with the way to read these three pipettes to ensure the procedure is accurately followed. It is also important to pick up pipette tips correctly to prevent contamination of the sample. Open the pipette tip box and push the pipette firmly onto one of the tips, making sure not to touch anything with your hand. After, close the box. With the correct volume set, you are ready to transfer the sample. Each pipette has two stops. When pushing the pipette plunger down, the first stop is the point of first resistance and represents the set volume. To pick up a sample, push the pipette down to the first stop and then release, sucking up the liquid. To deliver the sample, push the plunger down to the first stop and then all the way down to the second stop to ensure all of the sample is delivered. To discard the pipette tip over the appropriate waste container, press the ejection button on the back of the pipette.